An appeal has been made to countries in the region to collaborate and come up with innovative ways to accelerate their HIV responses. According to the World Health Organization, the number of reported disruptions in HIV services in countries has declined by almost 75% since June. Out of the 152 countries surveyed, 9 are still reporting disruptions between June 2020 and November 2020. Annually, on December 1st, the globe raises awareness on persons living with HIV. The Pan-Caribbean Partnership with HIV and AIDS says national AIDS programs and civil society organizations in the Caribbean region continue to be challenged in HIV testing due to COVID-19 protocols. They are calling on countries to take decisive action to ensure the continuity of HIV services during the COVID-19 pandemic. Director of Pancap, Dr. Rosamond Adams, highlights a few practices that have emerged from public health champions in the region.
In Belize, Enrique Romero, Executive Director of the National AIDS Commission, used his alliance with social workers, adherence counselors from the Ministry of Health Belize, peer navigators, the National AIDS Commission, district committees, and civil society organizations to conduct a needs assessment of people living with HIV. The assessment revealed that many people living with HIV were desperately in need of food items to remain adherent to their medication. Enrique jumped into action, and within a few days, he worked tirelessly with the Ministry of Health, Development, Social Transformation, and Poverty Alleviation to expedite assistance to those individuals through the Government of Belize's Food Assistance Program.
Dr. Adams says loss of employment, lack of essential support, and depleting nutritional supplies are some of the main issues that undermine adherence to HIV medication. He commends countries which have taken urgent action to protect persons living with HIV.
I urge our partners to share their stories and celebrate the success of maintaining the region's HIV response in the face of COVID-19. Our region has responded to the global pandemic with cooperation, unity, and innovation, which ensured the continuity of HIV services and better health outcomes for people living with HIV. Our governments, national programs, community mobilizers, and the public sector stepped up to provide the needed services so that people living with HIV can remain on their medication. Time will reveal how many lives were saved.
The Pancap director says that although the Caribbean is fighting the epidemics of HIV and COVID, more can be done.
I do believe that despite the challenges of 2020, our region can amplify the HIV response and fulfill the CRF's mandate of a Caribbean free of AIDS and new HIV infections, in which all people are happier, healthier, productive, safe, and respected. The partnership remains committed to supporting this momentum, and we stand in solidarity with everyone as each of us do our part in ending AIDS in the region.
Data from the WHO indicates that HIV infects 1.7 million people each year and kills some 690,000. On this World AIDS Day observance, global leaders are called to rally for, quote, global solidarity, unquote, to maintain essential HIV services to those most at risk during and post-pandemic. Colby DeVoe, HTS News Force.